I would like to thank you for attending my speech today on the epidemic rates of childhood mortality. We know that in the world today, 21,000 children die every single day from preventable causes and treatable diseases. 21,000 might be a really large number, kind of hard to wrap your mind around. But what if I told you that since I started talking, these 4 children have passed away? That makes it a little bit easier to understand, makes it a little bit more personal when the numbers are smaller. And it helps us to not lose the forest for the trees. Today you have the option to be involved and be interested in many different social and social justice issues. Today I'm asking you to be involved in this one. As a chaplain, I see the effects of the loss of life every day at work. I see what it's like when children young under the age of 5, newborns, pass away, and the effects that has on their family. And we live in a developed country. I can't begin to imagine the effects it would have on a mother who lost her baby in an undeveloped country, knowing that her child died of a completely preventable disease, but she didn't have access to those preventions. Christ is calling us to love and care for those who are seemingly unseen. We need to look at the statistics. Statistics tell us that 1 child every 4 seconds dies. 14 children every minute die. 21,000 every single day. And between 2000 and 2010, 91 million children lost their lives to preventable causes and treatable diseases. But what is causing these deaths? The World Health Organization tells us that the people that are most at risk are those who are born and live the first 28 days. In between the first 28 days, children are most at risk. 44% of deaths of children under the age of 5 occur during this time. But what is it specifically that's killing them? It is preterm complications. It's babies who get pneumonia. It's malaria in underdeveloped countries. And it's malnutrition in America as well as in third world countries. And we need to know where it's happening. Globally, there are 5 countries where half of the deaths of children under the age of 5 are taking place. They're Nigeria, the Congo, China, Pakistan, and India. We also need to know where this is happening locally. In your city, where are these deaths taking place? They're happening for children who are born in rural areas, in low-income neighborhoods, and they're happening in the homes of mothers who are not afforded the proper education. Mark 12:30 through 31 tells us to love God with all of our heart, soul, mind, and strength, and then to love our neighbors as ourselves. And if we love our neighbors as ourselves in this situation, what does that look like? It looks like encouraging pregnant mothers to get the proper care. It looks like encouraging mothers who have just had babies to make sure they're getting the proper vaccines. It looks like getting involved in organizations and churches that provide services to these women. And if you can't get involved in those ways, you can give. We can always give. Genesis 16:13 tells us that God is the God who sees. And in this situation, sometimes God calls us to be the ones who do the work. Since I started talking and presenting this speech, this many children have passed away in the world. That is a lot of children. But today, I'm not even asking you to be involved with all of these children. I'm asking you to be involved with this one. If this child was yours to protect, what lengths would you go to make sure that this child made it past 5? Thank you.